Welcome everybody to our celebration of the 5th anniversary of Precision Health. My name is Sebastian Zoellner. I'm one of the 3 co-directors of this enterprise. And I have to say, it's really great to see that many people all in person again. I think we all agree that having these types of interactions are so much more productive face to face. And it's also just nicer to talk to people in person. And of course, we would have a really hard time to get all that food to you through Zoom. That would have been a major logistical challenge. So to remind everybody, the initiative started as a presidential initiative in October of 2017, but we really only got going in January of 2018. So this is the 5th anniversary. And since then, in the beginning, we set a lot of pretty ambitious goals, and I think we can be safe to say that we've reached most of those goals, but we've also recognized that some of those goals were just unreasonable, silly, not useful, and some of those goals were just impossible. So along the way, we have built this world-class infrastructure and set of precision health tools that allows all of us to do the work of understanding modern health questions and of trying to help patients using large medical data sets and improving the life of patients. We have managed to create this great community here, and honestly, I'm really impressed how many people have turned out. And that is the other major resource that we're generating here. In all of this, we had great support from our partners in the medical school, in the School of Engineering, in the School of Public Health, and in the Office of the Provost. So now that it's 5 years, it's time to start setting a new goals and new things that we want to do next, right? We want to make sure that this enterprise continues to be a great resource for biomedical research at the University of Michigan. And in order to do that, Brahmaji, Jenna, and I can, of course, sit in a chamber and put our heads together and come up with some ideas, but it makes much more sense that we ask all the people here who actually use the data, who follow this dream of improving medical health care, to ask them what we can do, what we should do, how we can improve what we're doing. So we need to hear from you today and make sure that we grow in the direction that we're planning to. And this event today is actually planned to be quite interactive. There's very few situations where you can just sit and listen and maybe check your phone. In most of the things we're doing today, we're hoping for some level of participation from you. To give you an overview, right after this, you're going to see a video retrospective of the last 5 years. Then Dr. Rangi is going to give a short note of introduction. After that, Brahmaji is going to give an overview over everything we've reached, just so that you see this is the starting point from which we're moving forward. And after that, we have a panel discussion from 4 outstanding scientists about what they see, what the chances are, so that you can all hear different perspectives. We've hoped to collect people who are coming at this from very different directions, so that might help you to start thinking about how to move forward. After lunch, Jenna will give an overview over how we have, in a very big picture vision, envision precision health going forward. And after that, we're going to split out. Oh, and by the way, there's actually slides with this. After that, we're splitting out into member input sessions or focus groups or whatever you want to call that. In those focus groups, you can come back and tell us our vision is great and everything is perfect. But I really hope you're actually going to poke some holes into our ideas and show us this is good, but it could be better that way, right? And then we are done and we're trying to move on with our lives. So before we get started, there's a couple of logistical remarks. If you need anything, there are quite a few lovely people with staff badges on their staff hangers like this on their badges. Please ask them, and I'm sure they can help you. During the Q&A after Jenna's remarks, we ask you to use the notepad in front of you to write down your question and hand it in. This way, everybody will have equal access to be we have their question answered. Also, if at any other point you think of something smart, please write it down and let it come to us. Or something smart with relation to precision health. I'm sure you think of smart things all the time. And let it come to us so that we have a large number of new ideas that we can work through after this. So I think these are the things I needed to say. And with this, I'm now going to show you the video, assuming this technology works. I have to warn you a little bit. I managed to look incredibly scary on this video. I'm typically not, but I don't know what happened. Let's see if this works.
In 2017, U of M launched Precision Health as a presidential initiative, really capitalizing on advances in data science, big data management, genetic sciences, and other biomedical sciences, where researchers all over the world are really entering this space to enhance how we care for patients.
We were one of the first universities to really invest deeply in this space, and I think that that's been a really important piece of our work. Many universities have also invested in the idea of precision health, but I think that at Michigan, this program sits actually as a cross-school collaborative.
The University of Michigan, at least in my experience, is a very interdisciplinary place where there's very few boundaries between different departments and between different schools, and it's very easy to form these type of interdisciplinary groups that allow this type of research to be at its maximum impact.
So U of M isn't just the right place, it's the perfect place for this type of work to flourish. In addition to our breadth and our depth in research capabilities, we also have this culture of supporting multidisciplinary research and collaborations. And more importantly, we enjoy working with one another.
We very early focused on developing the compute environment and the analytic capabilities, as well as the data collection, the data cleansing, the data access. And so that was a huge undertaking. We also focused on work in developing our cohort. A lot of people have biobanks. We had a biobank, the Michigan Genomic Initiative, that we wanted to expand and increase and enhance in a number of ways, including diversity of ethnicity and diversity of disease.
So I think that precision health has done a lot in the last 5 years. We've really established, I think, a wonderful system for collecting data at scale across populations. We've also created a method for us to be able to curate this data and then make it available broadly to researchers across campus so they can ask really novel and important questions.
Precision health is in a very good place. We have an amazing data set that is very rich and provides opportunities that are very unique. We can combine that with a highly trained, highly competent support staff that can help researchers at Michigan to set up their research. And all of this is guided by an enormous amount of scientific expertise that can help us grow this data set in the directions where they are most beneficial to researchers.
The most meaningful collaborations that I've seen in my role as co-director have been those that have spanned multiple departments, multiple schools, multiple colleges, where researchers come together around a shared vision, but at the end of the day, there's something in it for everyone.
Another major collaboration was understanding the genetics of COVID risk. Having the University of Michigan Biobank allowed us directly to identify individuals that had gotten infected with COVID and compare their genetic profiles with individuals who had not gotten infected with COVID, and thus identify which genetic factors were underlying the genetic risk.
Where we were able to also act rapidly is the development of discovery around how pulse oximeters, which are tools that we use at the clinical bedside each day to measure blood oxygen saturation. Pulse oximeters may actually have some bias towards certain types of skin colors. Darker skin colors seem to cause effects in terms of how the device reads, and that can actually have clinical implications.
When we started Precision Health, we knew that for it to be successful, it really had to depend on multidisciplinary collaborations with scientists from the biomedical sciences to the engineering sciences to the social sciences. And we knew if we could form those type of collaborations, we would be able to enhance patient care.
I think we have spent the last 5 years building phenomenal infrastructure, and we have resources now. We can still expand those resources, and in particular focus on the diversity of the cohorts. In addition, really work on implementing or translating our findings, our discoveries, to the bedside. So that's where I'm really excited about seeing progress in the next 5 years.